Well, let's bring in Dr. Lizzie Toberty from Doctors Association UK joining us now. Hi, Doctor. Thank you very much indeed for joining us on the programme this morning. We are being told that 1 in 4 Britons could lose their GPs within a decade. That's very concerning.
It's extremely frightening. What we're seeing is a very worrying pattern of demise of our general practice system. And those figures have come from the Health Foundation, who have predicted that by 2030, we might have lost the equivalent of 8,800 full-time equivalent GPs. So it's a welcome focus on general practice this morning, but I'm not sure that these are the right solutions.
Talk to us a bit more about the research, what it's found in terms of who will be worst impacted.
So we know already that the places that have the highest GP to patient ratio, so the most difficulty accessing a GP, are our most deprived areas. And especially within those areas, we're seeing life expectancy stalling, and in some areas it's also falling as well. So it's our deprived communities who are going to suffer the most yet again.
The whole premise of the National Health Service, from cradle to grave, free healthcare at the point of usage, is that starting to erode? Is that what you're saying?
Yes, absolutely. Because what is happening, market forces take over. When there is demand for something that isn't there, the private sector does start to expand. And we are seeing a tremendous growth in private healthcare. And of course, if you're somebody sat at home worried about your health and you're struggling to access primary or secondary care and you've got the resources, you're going to seek out a way to do that, because what's more important than your health? But unfortunately, there's lots of people who don't have those resources and who don't have the ability to do that. And those people, unfortunately, are going to be the ones who are most affected by this. And my worry is that we're going to start seeing premature deaths from preventable diseases because people simply cannot access what they need in a timely manner.
Over what time scale do you think are you worried that might happen?
It's happening now. We're seeing excess deaths now, but without decisive action, it's going to continue and it's going to worsen. And that's what the figures from the think tanks and things are saying.
Why is there such poor job retention in the National Health Service?
I think traditionally we've had a view that the NHS was this fantastic place to work. And I do wonder if 20, 30 years ago it really was. Right now, we're being asked to do more and more with less. And what has happened is over the years, people have stepped up to the mark. They have done their best to stand between patient needs and ever reducing resources. But that, plus a COVID pandemic, has really started to take its toll. And it's a downward spiral. So the less people there are and the higher the demand, the more problems that there are and the more difficult the job is. And so it's only natural that people start to look at what their other options are.
Indeed so. Doctor, it's